Everything you need to know about dementia. This video discusses everything you need to know about dementia, symptoms, causes, types, stages, diagnosis, treatment, prevention, life expectancy, dementia versus Alzheimer's, dementia from alcohol, aging, prevalence, research, and outlook. What is dementia? Dementia is a decline in cognitive function. To be considered dementia, mental impairment must affect at least 2 brain functions. Dementia may affect memory, thinking, language, judgment, behavior. Dementia may be caused by a variety of illnesses or injuries. Mental impairment may range from mild to severe. It may also cause personality changes. Some types of dementia are progressive. This means they can get worse over time. Some types are treatable or even reversible. Some experts restrict the term dementia to irreversible mental deterioration. Dementia signs and symptoms. Dementia can cause symptoms such as not coping well with changes. Someone may have a hard time accepting changes in schedules or environment. Subtle changes in short-term memory making. Someone can even remember the event of 15 years ago like it was yesterday, but they can't remember what they had for lunch. Reaching for the right words. Word recollection or association may be more difficult. Being repetitive. Someone may ask the same question, complete the same task, or tell the same story multiple times. Confused sense of direction. Places someone once knew well may now feel foreign. They may also struggle with driving routes they have taken for several years because it no longer looks familiar. Struggling to follow storylines. Someone may find following a person's story or description difficult. Changes in mood. Depression, frustration, and anger are not uncommon for people with dementia. Loss of interest. Apathy may occur in people with dementia. These include losing interest in hobbies or activities they once enjoyed. Confusion. People, places, and events may no longer feel familiar. Someone might not remember people who knew them. Difficulty completing everyday tasks. A person in the early stages of dementia may have trouble recalling how to do tasks they have done for many years. What causes dementia? Dementia has many causes. In general, it results from degeneration of neurons, brain cells, or disturbances in other body systems that affect how neurons function. Several conditions can cause dementia, including diseases of the brain. The most common causes are Alzheimer's disease and vascular dementia. Some of the common causes of dementia include neurodegenerative disease. Neurodegenerative disease means the neurons gradually stop functioning or function inappropriately and eventually die. This affects the neuron-to-neuron connections called synapses, which are how messages are passed along in your brain. This disconnect can result in a range of dysfunction. Alzheimer's disease, Parkinson's disease with dementia, vascular dementia, chronic alcohol use disorder. Another cause is frontotemporal lobar degeneration. This is the blanket term for a range of conditions that cause damage to the frontal and temporal lobes of the brain. They include frontotemporal dementia, Pick's disease, supranuclear palsy, corticobasal degeneration. Other causes of dementia. Dementia has other causes, including structural brain disorders such as normal pressure hydrocephalus and subdural hematoma, metabolic disorders such as hypothyroidism, vitamin B12 deficiency, and kidney and liver disorders, toxins such as lead, certain tumors or infections of the brain, medication side effects. Some of these types of dementia may be reversible. These treatable causes of dementia may reverse symptoms if they are caught early enough. This is one of the many reasons why it's important to contact a doctor and get medical checkup as soon as symptoms develop. Types of dementia. Most cases of dementia are symptoms of a specific disease. Different disease causes different types of dementia. The most common types of dementia includes Alzheimer's disease. The most common type of dementia, Alzheimer's disease makes up 60 to 80% of dementia cases, according to Alzheimer's Association. Vascular dementia. This type of dementia is caused by reduced blood flow in the brain. It may be the result of a plaque buildup in the arteries that feed blood to the brain or a stroke. Lewy body dementia. With Lewy body dementia, protein deposits in nerve cells prevent the brain from sending chemical signals. This results in lost messages, delay reactions, and memory loss. Parkinson's disease. Individuals with advanced Parkinson's disease may develop dementia. Symptoms of this particular type of dementia include problems with reasoning and judgment, as well as increased irritability, paranoia, and depression. Frontotemporal dementia. Several types of dementia fall into this category. They are each affected by changes in the front and side parts of the brain. Symptoms include difficulty with language and behavior, as well as loss of inhibition conditions. Other types of dementia exist. However, they are less common. In fact, one type of dementia, Creutzfeldt-Jakob disease, occurs in 1 in 1 million people. Stages of dementia. In most cases, dementia is progressive, getting worse over time. That said, dementia progresses differently in everyone. However, most people experience symptoms of the following stages of dementia: mild cognitive impairment. Older adults may develop mild cognitive impairment, MIC, but may never progress to dementia or any other mental impairment. People with MCI commonly experience forgetfulness, trouble recalling words, and short-term memory problems. Mild dementia. At this stage, people with mild dementia may be able to function independently. Symptoms include short-term memory lapses, personality changes including anger or depression, misplacing things or forgetfulness, difficulty with complex tasks or problem solving, difficulty expressing emotions or ideas, moderate dementia. At this stage of dementia, people affected may need assistance from a loved one or care professional. That's because dementia may not interfere with daily tasks and activities. Symptoms include poor judgment, increased confusion and frustration, memory loss that reaches further into the past, needing help with tasks like dressing and bathing, significant personality changes, severe dementia. At this late stage of dementia, the mental and physical symptoms of the condition continues to worsen. Symptoms include inability to maintain bodily functions, including walking and eventually swallowing and controlling the bladder, inability to communicate, requiring full-time assistance, increased risk of infection. People with dementia will progress through these stages of dementia at different rates. Dementia testing. No single test can confirm a dementia diagnosis. Instead, a doctor will use a series of tests and exams. These include a thorough medical history, a careful physical exam, laboratory tests, including blood tests, a review of symptoms, including changes in memory, behavior, and brain function, a family history. Doctors can determine if you or your loved one is experiencing symptoms of dementia with a high degree of certainty. They may not be able to determine the exact type of dementia. In many cases, symptoms of dementia types overlaps. That makes distinguishing between types difficult. Some doctors will diagnose dementia without specifying the type. In that case, you may wish to visit a doctor who specializes in diagnosing and treating dementia. These doctors are called neurologists. Some geriatricians also specialize in this type of diagnosis. Dementia treatment. Two primary treatments are used to alleviate symptoms of dementia: medications and non-drug therapies. Not all medications are approved for each type of dementia, and no treatment is a cure. Medications for dementia. Two main types of medications are used to treat symptoms of Alzheimer's disease and other dementia-causing conditions. Cholinesterase inhibitors. These drugs increase a chemical called acetylcholine. This chemical may help form memories and improve judgment. It may also delay worsening symptoms of Alzheimer's disease. Memantine. This drug is used to delay the onset of cognitive and behavioral symptoms in people with moderate or severe Alzheimer's disease. Memantine may let people with Alzheimer's disease maintain their usual mental function for a longer period of time. These two drugs may also be prescribed together. Side effects can occur. Other medications may be prescribed to treat related symptoms, such as impaired sleep, mood changes, and more. Aducanumab, Aduhem. Aducanumab is another medication approved to treat Alzheimer's and may slow the progression of the disease, though research is ongoing. Aducanumab is an anti-amyloid antibody therapy delivered intravenously. It targets a specific protein fragment that may disrupt communication between nerve cells in the brain. Non-drug therapies. These therapies may help reduce symptoms of dementia and alleviate some of the manageable complications of the condition. Common non-drug treatments for dementia include modifying your environment. Clutter, noise, overstimulation may reduce focus. Modifying common tasks. You can work with a therapist or other healthcare professional to break down everyday activities such as showering or grooming into manageable tasks. Occupational therapy. Occupational therapists are specialist healthcare professionals who can help you learn to be safer and more secure with tasks, including walking, cooking, and driving. Dementia prevention. For decades, doctors and researchers believe dementia could be prevented or cured. However, new research suggests that may not be the case. A 2017 review found that more than 1/3 of dementia cases may be the result of lifestyle factors. Specifically, the researchers identified 9 risk factors that may increase a person's chances of developing dementia. They include midlife hypertension, midlife obesity, hearing loss, late life depression, diabetes, physical inactivity, smoking, social isolation, lower levels of education. The researchers believe that targeting these risk factors with treatment or intervention could delay or possibly prevent some cases of dementia. A 2019 retrospective study looked at nearly 200,000 participants of European ancestry. The study suggests that lifestyle factors such as smoking status, physical activity, diet, and alcohol consumption could potentially contribute to the risk of dementia. These findings suggest that working with a doctor to maintain a healthy and active lifestyle could help prevent or delay the onset of dementia. Dementia life expectancy. Individuals living with dementia can and do live for years after their diagnosis. It may seem that dementia is not a fatal disease because of this. However, late-stage dementia is considered terminal. It's difficult for doctors to predict life expectancy in people with dementia. Likewise, factors that influence life expectancy may have different impacts on the length of life in each person. In one 2015 study, women diagnosed with Alzheimer's disease lived an average of 5.7 years after diagnosis. Men lived 4.2 years. Life expectancies, the study found, may be shorter for individuals with other types of dementia. Certain risk factors increase the likelihood of deaths in people with dementia. These factors include increased age, being born male, decreased capacities and functionality, additional medical conditions, disease or diagnosis such as diabetes or cancer. However, it's important to remember that dementia does not follow a specific timeline. You or your loved ones may progress through the stages of dementia slowly, or the progression may be rapid and unpredictable. This will affect life expectancy. Dementia versus Alzheimer's disease. Dementia and Alzheimer's disease are not the same. Dementia is an umbrella term used to describe a collection of symptoms related to memory, language, and decision-making. Alzheimer's disease is the most common type of dementia. It causes difficulties with things like short-term memory, depression, disorientation, behavioral changes. Dementia causes symptoms such as forgetfulness or memory impairment, loss of sense of direction, confusion, difficulty with personal care. The exact constellation of symptoms will depend on the type of dementia you have. Alzheimer's disease can also cause these symptoms, but other symptoms of Alzheimer's disease may include depression, impaired judgment, and difficulty speaking. Likewise, treatment for dementia depends on the type you have. However, Alzheimer's disease treatments often overlap with other non-pharmacological dementia treatments. In the case of some types of dementia, treating the underlying cause may be helpful in reducing or stopping the memory and behavioral problems. However, that is not the case with Alzheimer's disease. Comparing the two may help you tell the difference between symptoms you or your loved one may be experiencing. Dementia from alcohol. Alcohol use may be the most preventable risk factor for dementia. A 2018 study found that the majority of early onset dementia cases were related to alcohol use. The study found that nearly 1/3 of early onset dementia cases were directly linked to alcohol, plus 18% of people in the study had been diagnosed with alcohol use disorder. Alcohol use disorder, the researchers discovered, increased a person's risk of dementia threefold. Not all drinking is dangerous to your memory and mental health. Moderate levels of drinking may even be beneficial to your heart's health. These include no more than 1 glass per day for women and 2 glasses per day for men. It's not forgetfulness a normal part of aging. It's absolutely natural to forget things once in a while. Memory loss by itself does not mean you have dementia. There's a difference between occasional forgetfulness and forgetfulness that is a cause for serious concern. Potential red flags for dementia include forgetting who someone is, forgetting how to do common tasks, such as how to use the telephone or find your way home, inability to comprehend or retain information that has been clearly provided. Get medical attention if you experience any of the above. Getting lost in familiar setting is often one of the first signs of dementia. For example, you might have trouble driving to the supermarket. How common is dementia? According to World Health Organization, WHO, approximately 55 million people have dementia worldwide, with around 10 million new cases reported each year. The number of people receiving dementia diagnosis or living with dementia is increasing. This increase is due partly to increasing life expectancy. By 2030, the size of the population 65 years old of age and older in the United States is expected to almost double from 37 million people in 2006 to an estimated 74 million by 2030, according to the Federal Interagency Forum on Aging-Related Statistics. The rates of dementia will likely increase with this larger population of people older than 65. What research is being done? Scientists all over the world are working to gain a better understanding of the many different aspects of dementia. This might help to develop preventative measures, improved early detection diagnostic tools, better and longer lasting treatments, and even cures. For example, 2018 research on mice suggests a common asthma drug called xylutine might slow, stop, and potentially reverse the development of proteins in the brain. These proteins are common in people with Alzheimer's disease. Another 2021 review suggests deep brain stimulation could be an effective way to limit symptoms in Alzheimer's in older adults. This method has been used to treat symptoms in Parkinson's disease, such as tremors, for decades. Even simple blood tests have now been developed that can detect Alzheimer's, according to a 2021 study. As well, researchers are looking at the possibility of slowing the progression of Alzheimer's. Scientists are investigating a variety of factors they think might influence the development of dementia, including genetic factors, various neurotransmitters, inflammation, factors that influence programmed cell death in the brain, tau, a protein found in neurons of the central nervous system, oxidative stress or chemical reactions that can damage proteins, DNA, and lipids inside cells. This research can help doctors and scientists better understand what causes dementia and then discover how best to treat and possibly prevent the disorder. According to a 2019 study, there's also increasing evidence that lifestyle factors may be effective in decreasing the risk of developing dementia. Such factors might include getting irregular exercise and maintaining social connections. Outlook. Currently, the Center for Disease Control and Prevention (CDC) says that Alzheimer's disease is the 7th most common cause of death in the United States. That said, people with dementia will progress through the illness at varying speed and experience different symptoms. There's currently no cure for dementia, but plenty of research is still being done. Hopefully one day, outlooks will improve. If you are experiencing memory issues or any other symptoms that point to dementia, talk with your doctor as soon as possible. Early diagnosis can help people with dementia and their families plan for the future. Hi, thanks for watching to the end. I hope this video has been informative and helpful. If you like this video and you would like to see more contents like this, kindly like, share, leave a comment in the comment section, and also please subscribe to this channel if you have not already subscribed yet. Thanks for watching to the end. Have a nice day and look out for the next video.